Hello, I'm Dr. Djordje Koldzic, Chief of Outpatient Psychiatry at Tufts Medical Center. Today I would like to talk to you about dealing with fear and anxiety during the COVID-19 pandemic. In talking directly to my fellow physicians and other clinicians, particularly those working with or anticipating providing direct care of COVID-19 patients, questions of managing our own anxiety and fear are what I hear the most. Firstly, let's look into what anxiety and fear really is. Simply put, fear is an exaggerated reaction of our own brain to an idea of danger. So, two pieces to this definition. One is this idea of danger. Please note that I'm not saying here that the danger is not real. No, it is truly real. In this case, the coronavirus and COVID-19 related danger. Yet, what is important to understand is that while under the fear response, our brain greatly overestimates the real danger that caused or triggered that fear response. And in the process, our brain exaggerates our mental and physical reaction to that triggering danger. Good example is one of the most common phobias, a little bit extreme example, fear of flying. Is it theoretically possible that flying could be dangerous? Yes, absolutely. Is it likely or even remotely likely that a flight will end up as a deadly accident? Absolutely not. And yet, for people with fear of flying, what that intense fear does, it hijacks their perception of reality, takes it out of the context, and makes them believe that every single flight is going to end up crashing. Why is it so important that we start taking control over our mind's fear response? Because that fear response, if not kept under check, will not only prevent you from performing your physician duties or other clinical duties, but will also, as I mentioned, it will hijack your sense of reality and make it very difficult for you to function in any setting, including at home with your family, affecting your ability to rest and sleep, and potentially producing a slew of serious psychological symptoms. There are two key elements to taking control of your fear response. One is clear intention, and two, adequate strategy. Clear intention deals with you answering to yourself the following questions. Have you really, truly decided to not live in fear? And if so, what mental energy are you willing to put into that decision? Have you really, truly decided to face your anxieties? That first step, that decision to not live in fear, an undivided intention to do something about it, is a lot of times the most important step to this process. Once you have made that unwavering decision to do something about your fear, learning and implementing proper strategies becomes much easier. Which brings me to the second element, the actual strategies. So by strategy, I mean learning and practicing mental techniques to take control of your anxieties and fears. The following mental techniques will give you the tools to practically follow through with your decision to not be afraid. Number one, first and foremost, breathe. As simple as it seems, taking slow, deep breaths through your nose is the most efficient way of countering your body's hyperarousal, anxiety, and fear response. Why is it so important? Fear and anxiety affects our breathing very predictably. It increases the frequency of shallow through your mouth breathing. As much as this may be a helpful and adaptive immediate reaction in our fight or flight type situation, when held on to the longer periods of time, it greatly worsens our state of psychological anxiety and physical hyperarousal. So, by simply slowing down and deepening our nose breathing, we actively counter our fight or flight hyperadrenergic stress response. No wonder this type of relaxed breathing is one of the most used and helpful meditation and relaxation response inducing techniques. Number two, staying in the here and now. Mindfulness or staying present is probably one of the most efficient ways of dealing with our anxious minds, whatever the cause. What anxiety and fear typically do to our thoughts, they take them out of the current moment and push them into some worst-case scenario future, in the similar way that depression makes our thoughts get stuck in some sad, regretful place in the past. In both of those scenarios, what is lost, what we are depriving ourselves from, is a meaningful, calm, thankful presence in this current present moment. This golden grail of calm, this powerful here and now, as some experts in the field refer to it, is not only the topic of many New Age self-help psychology books, but also a scientifically proven and officially accepted type of psychotherapy called mindfulness-based cognitive therapy. Number 3, facing your fear. Not the most popular nor the easiest technique to practice or concept to think of, yet try answering rationally to yourself. What are you really afraid of? What other fears has this current COVID-19 fear been triggering for you? What is the true science behind the virus, this disease anyway? What low percentage of people, even in the worst case scenarios, will get hospitalized or die? What high percentage of people have very mild disease, even in the case they do end up contracting it? Try recalling in your mind all the times you yourself got sick and recovered fully. Get the right facts about this disease and use them as rationally as possible to fight negative and irrational thoughts that your mind has been creating. Those catastrophical, anxiety-ridden, highly unrealistic, worst-case scenario thoughts that include yourself and your family. Number 4, systemic behavioral desensitization. This is a fancy term for a simple concept of fighting fear by getting used to it. What do I mean by that? Well, very often anticipation fear and anticipation anxiety feels way worse than the actual thing that we are afraid of. We're all highly trained clinicians. Caring for the sick is what we do best. Once we're busy doing exactly that, we will realize that caring for COVID-19 patients may not be any different than caring for any other sick or patient in need. By following established rules and procedures, day in and day out, our minds, on their own, will start letting go of those irrational fears by finding the soothing and relaxing power in simply performing our jobs, our own daily routines. Number 5, acceptance. Another powerful concept and cognitive tool, and concept similar to the previous one, also part of a formal acceptance and commitment cognitive behavioral therapy ACT. What this concept teaches us is how opening up to unpleasant feelings and fears, and learning how to not overreact to them, or how not to avoid situations where they're invoked, we start this almost paradoxical positive spiral of feeling better. That positive spiral then has potential to lead us to a better understanding of what really, truly matters. So, instead of trying to control your negative feelings, thoughts, sensations, memories connected to COVID-19, you can start practicing the curative effect of just noticing, accepting, and embracing those negative and fear-inducing events. What this does for you in return is help you disconnect from your negative and fear-inducing thoughts and feelings, de facto giving you almost this passenger seat, removed, neutral, and calm feeling, effectively disconnecting you from your own pain. If practiced regularly, acceptance can be a powerful trigger of bringing even more clarity to your personal values and helping to bring new meaning to your own life beyond any fear or any anxiety. So, in summary, you don't have to live in fear. You don't have to experience extreme anxiety. The choice is yours regardless of the circumstances. Make a conscious decision to face your fear, then use one or more psychological tools to continue despite that fear. Thank you for listening.